There are drug interactions, for instance, that can affect whether or not it's safe for a person to take opioid medications. And sometimes your doctor may need to adjust your medications or adjust the doses of your medications if there are interactions that can be significant in terms of increasing your risk for side effects with the opioid. Ideally, they're meant for short-term use, not to treat chronic pain. And, you know, oftentimes that's maybe for a few days after a surgery or a planned intervention. And so, along with that, when your doctor prescribes an opioid medication, sometimes they'll describe that you should be using that over a period of time. You should reduce the amount of medication that you're using. So you might start out using it a couple times a day for a day or two and then decrease to once a day, or gradually move to taking a different medication like acetaminophen or Tylenol. Well, there's different ways that medications can interact with opioids, but a common way is that they cause what we call additive effects. So opioids can cause drowsiness, but other medications cause drowsiness as well. For instance, zolpidem, which is a sleep aid known as Ambien. So if we take two medications that each can cause drowsiness, taking them together can cause additive drowsiness, making it much more significant and greatly increasing our risk for more severe side effects, such as respiratory depression or reduced breathing. Alcohol is also, and people don't necessarily think of that as a drug, but when it comes to drug interactions, we consider it that way, and it definitely contributes to that reduced or slowed breathing that we can see. A person might have constricted pupils, so they're very small pinholes and they don't respond to light. Usually your pupils open up, but they don't respond to that. A person could have slowed breathing, or in more severe cases, they could lose consciousness and you might not be able to wake them from that. Sometimes people's lips or their fingernails will turn bluish, and so those are all signs or symptoms that we have a medical emergency and we need to call 911.